Hey guys, so this video is on medication safety and dosing, and then also kind of some things with price and a few other things. Um, let's see. So the first thing for this video, and I've touched on this in a couple of the other ones, is for safety, a big thing is checking the MAR here and kind of making sure that everything, like making sure that you're aware of every medication your patient's getting, um, and there's nothing on there that you don't want them getting. Um, so that's kind of the first thing for safety. Um, and then we'll go into a couple other things, but one, we'll talk about kind of say you want to prescribe Lasix to your patient. Um, and especially kind of being new, so like as an intern or probably especially an intern, but also a med student, you don't really know the safety or the dosing maybe yet. And so there's other resources for this, but the one that I use is UpToDate. So basically you can just click right here, um, and then it pulls this up. So type in the name of the medication. You can either do the brand name or the trade name or the generic name. Um, and then go here, and it's always for every medication, it has one of these pages. It's called drug information. So click on that. And then I'm kind of all day long looking at these to make sure I'm doing the right doses and stuff like that. And so I think this is something you definitely need to look at. So the first part of this is the let's see, is the black box warning, or warnings if there's more than one. So it'll have up here. And then there's a lot of info that we'll go through on this page. But as far as dosing, click here for adult dosing. They also have renal impairment that we'll talk about, and then pediatric dosing. So to see what the dose is, and you do have to use kind of clinical judgment too, but this is generally what you'll use as far as the dose. Um, so when you click on the dose, it'll have these different indications. And so let's say the patient has a CHF exacerbation, and then you're using this indication, like you're using it to diurese the patient for their volume overload. So it's going to give you let's see, a lot of information here on kind of how to use it. And then the different formulations, like whether it's oral or IV. So you can look at that as far as how to dose it. If it's this one doesn't have it, but a lot of times right under this, it'll have like how to discontinue a med, if they're stopping it, or like how to transition between different meds in that class or different things like that. Um, and then I would say if it's your first time prescribing a medication, like as a new doctor, obviously you need to look up the dose and everything, but some different things to look at are, one, the black box warnings. And some of this is kind of more an outpatient thing. Say a patient's going to be on a medication for the next like several decades, they definitely need to know the side effects, and you need to know kind of the safety of the medication. So look at the black box warning. Um, and then look at the different side effects. It'll have the main ones up here. Let's see. And then one nice thing, for some reason it doesn't have it on this, but generally they'll have the percentages. So it'll say, 12% of people had this type of side effect. 14% of people had this side effect. So that can be kind of nice to go through with the patient and to see like how likely actually is this specific side effect. Um, And then the next one to look at would be contraindications. Um, and then I think lastly, probably as far as the safety would be, and this again is more an outpatient thing, but we still prescribe outpatient medications in the hospital because on discharge, a lot of times you start people on new medications, so you need to be aware of this. So the last part is monitoring parameters. So say you're discharging a patient on a higher dose of Lasix than when they came in, kind of, and it doesn't specifically have it here, but you would need to, when they're like say a week later when they follow up with their primary care doctor, they should probably check their electrolytes like potassium and magnesium, and also their kidney function, to make sure that they're okay. Different meds have different monitoring parameters. Um, like for example, antipsychotics, you want to check like for signs of metabolic syndrome, like their lipid panel, And then some meds have a ton of monitoring parameters like lithium or some of those kind of more higher risk medications. So you absolutely have to be aware of this. So those are the main things I would say to look at. There's other things that are kind of just nice to reference, like you can see the mechanism of action, you can see the pharmacokinetics. So like the half-life or like the onset of action. So like how quickly the medication takes effect in their system. There's like OB concerns, so like the safety of it with pregnancy, breastfeeding, different interactions. As far as interactions, actually, UpToDate, just to jump on this tangent, UpToDate has a nice interaction checker just on the main homepage. You just put in your meds there and click analyze, and it'll give you a nice summary of like the potential interactions. I think those are the main points here. So another one I want to go over, I'm just going to use this as an example, one of the antibiotics, but one of the big things is the renal dosing for medications. So this is a good one because it has very specific kind of protocols or ways of doing this. So if you go here, so if you start a patient on this medication, you need to be aware of the renal dosing. So go on MD-Calc and then calculate their creatinine clearance. And then you would kind of plug it in the chart here. Say their creatinine clearance is, say like 35. They would fall kind of under this box here. So instead of giving them the normal dose for an adult, then you would do the dose here. So this is kind of a good thing to be aware of. Let's see. I think that's it for what I wanted to show you guys on UpToDate. And then let's see. And then another thing as far as pricing, let me pull up an order. So when you're discharging a patient, if you're prescribing any medications, you can either send it to, well, I guess 3 options. One, you could potentially print a paper prescription. You have to do it on like the special paper, I think. And then the second option would be to send it to an outside pharmacy like CVS or something. And then the third option, and this is only available Monday through Friday, but you could send it downstairs to the CMC outpatient pharmacy. And then they call it like meds to bed. And then they can actually bring it up to the patient. With just kind of something with that is it doesn't, like anything you order during a hospitalization is added onto the hospital bill. But for some reason, these outpatient prescriptions aren't. So they won't fill the prescription unless the patient can actually pay for it. And for some reason, outpatient prescriptions aren't added on to the hospital bill. So sometimes if it's an expensive med, it's just not gonna, or it's not just gonna get lumped into the hospital bill. Like a lot of, like say you order an MRI or something, you don't have to worry about the cost. Like since it's medically indicated, you're obviously gonna order it for the patient, but that's not the case all the time with these medications when you're discharging somebody. So be aware of that. But basically to do these prescriptions, so or an outpatient prescription, you click here and then you type in the med. So let's say we want to do, and generally you don't do like longer than a 30-day prescription because they need to follow up with their primary care to get more refills. So you fill it out just kind of like a normal prescription. I would put in the diagnosis, because then their insurance, I think, covers it under that diagnosis. And then you would put the pharmacy. You can find their pharmacy there or the CMC. So that's kind of how you do that. And then one thing as far as a little trick, it's not going to work on this patient because it's a test patient, but something you can do is when you type in the name of the med like this, you'll see this little list that pops up, but then if you click enter, it'll show you like all of these. And then you'll see, so if the patient's insurance is plugged into the system, and this doesn't work 100% of the time with prescriptions, but or with meds, but you'll see if the medication is in the insurance's formulary, then it'll have a little green dash here, and if it's not, it'll be red. And then that can kind of help you to determine which ones their insurance will cover. And again, it's not 100%, but it's pretty good. Let me just show you an example of that. Let's see. Here's kind of what it would look like. So we typed in temazepam, and then it's showing that their insurance will pay for only these specific doses of the temazepam and not these doses. So that's kind of something to keep in mind. Let's see. Let me see. So I think that's it for this video. I think that covers most of the things as far as medication.